Thank you, Dan, and thank you, ICP. Our next award is Excellence in Best Practice Award, and I'd like to call up Sherry Ellis and Dr. Genie Bailey of STAR up to the stage. Woo-hoo. The Award for Excellence in Best Practices recognizes individuals who demonstrate exceptional planning, implementation, and ongoing integration of best practices. Sherry Ellis, CEO of STAR, is our presenter, and our awardee, Dr. Genie Bailey of STAR. Congratulations.
So since Jeannie's the one that's good at outcomes, and she's so good at preparation, I'm not going to use what I prepared because I just want to talk about Genie. I've heard so many things from the heart today, and it's so easy to find so many things about Genie. So Genie Bailey is a doctor who is a Duke Medical School graduate. She is dual certified in both psychiatry and addiction medicine, and she has dedicated her life to working in community behavioral health. And she is someone who, no, you can't recruit her, but she is someone who goes above and beyond every day. She's been at STAR for 19 years. She runs a very robust research program that is really unique in community behavioral health. And her research with Brown and with Boston University has led to STAR being able to be a forerunner in injectables and substance use disorder care. Harm reduction was a word at STAR before it was a word in other places because she was always keeping STAR at the cutting edge. She is an amazing, amazing leader. When I was doing this, I couldn't decide which to nominate her for because her leadership skills are amazing for her team. She runs multiple teams. She runs the second largest buprenorphine clinic in the state with 950 patients coming in. She oversees our Bridge Clinic. And on top of all of this, I just want to make it perfectly clear, she carries a patient load and she covers Bridge Clinic. She supervises 6 psychiatric nurse practitioners. She used to, in the past, when STAR had a co-occurring unit and was doing EADS, she did all of the psychiatry and oversaw all psychiatry and substance use disorder medicine on the EADS unit. And so that is what Genie does, and there is so much more than that. She spreads her ability to lead and to promote best outcomes and patient-centered care across the entire organization. But now I want to talk about a little bit about what Genie is, and I swear, Ken, it's going to be short. So Genie is an incredible human being. I came to STAR, she's been here for 20 years. I came to STAR 2 years ago, and Genie was part of the selection committee. And I was interviewing as the CEO, and there was this brilliant person on the call, and it was COVID, so there were like 9 people on a conference call interviewing me. And Genie had the most poignant questions and really put me through my paces. But then we kind of got off track talking about ketamine advances and what we could do with ketamine now. And we were off on this entire conversation before we realized that the entire board's mouths had dropped open and they were just kind of looking at us like we were nuts. So Genie had me at hello. She has been the best partner, and moving into her role as Chief of Behavioral Medicine at STAR, she has been a right hand in making sure that we take care of everybody who walks through the door at STAR. She's incredible. I think the first Christmas party she invited me to, and by the way, this woman funds the Christmas party herself for her own staff. So she invited me to this Christmas party, and there's literally like 30 people there. And she had made up a pin the bow on Dr. Bailey game. And so it was on the wall, and she was literally tying the blindfold on everybody, turning all of us around and making us go at her face with the bow so that we either had to try to get it under her chin or on her head. And it was then that I knew that I am going to love Genie Bailey for my entire tenure at STAR because she's innovative. I'm looking so forward to next week because she tries to get everyone involved in understanding the role that research plays at STAR and the role that it plays in what we do about best practices and evidence-based care. And so she does these little things. Like at Easter time, she fills a whole bowl with jelly beans, and she makes prizes for it, and she makes everyone come from every part of the organization and guess how many jelly beans, because they want to win the prizes. And so everyone comes into research, and they have all these things going on, and next week is the best one of all. Her team competes, and they decorate their offices for Halloween. And so some of them have these like hearts under glass, others have spiders crawling from the ceiling, others have a whole light show. And I think those are the things that are really Genie Bailey. And she is incredible. I call her the woman under the bushel because she has never asked for praise. She has never looked for anything. She has existed in this organization for 20 years and really not had recognition consistent with what she brings to the table and what she's done in this industry. She's nationally published for all of her research with these organizations multiple times over. She lectures. She's on Brown's staff. She's just incredible. And so, therefore, I think Genie Bailey is the perfect person to celebrate today at ABH's event. Genie.
Oh my goodness. Oh my goodness. That's hard to follow. And I guess at this point, I just want to say thank you and new friends here at the association. It's not a group that I've been really participating in, but I think that was a mistake on my part. This has been a fun day, and I really appreciate and I feel very humbled and honored to be here accepting this award. I feel like this is as close to the Oscars as I'm ever going to come. So I think I'm supposed to hold it up over my head and and thank my mother and my father and my and go through a whole list of everyone who worked in the sound and the lights. But before I do that, I did want to say a few other things that I'm really not supposed to be here. As a daughter, and I'm going to cry too, probably, but as a daughter of a tenant farmer from rural North Carolina, I'm not supposed to be here. And I say this in the spirit of the DEI conversation. As a graduate from a Baptist-supported, small, liberal arts girls' school, put that in quotes, that's what it was when I was there, I'm not supposed to be here. I was lucky enough to find a position at the Duke Medical School, and from there I went to Yale, and I can tell you, I was definitely not supposed to be there. My then very thick Southern accent, which comes out when I'm anxious, so you're hearing it now, but back then it was even worse, often kept people from hearing me and accepting my answers and my intelligence. I was seen as the one who had the accent, and I felt like I definitely I was not comfortable and didn't want to and shouldn't be there. I often felt lonely, isolated, and outclassed, and I certainly think that class is part of DEI. So for me, it was overcoming some of that. It was using a good therapist, meeting a lovely man, and finding my life change for the good. And I think that things certainly got better for me. We had 2 lovely children. I had a career. I was busy getting my life together, and we ended up finding ourselves in Providence. And after a decade and a half or so, I was not supposed to leave Brown to go to STAR. Stanley Street Treatment Resources, Inc. is in Fall River, Mass. I was not supposed to leave Brown to go to that job. And 19 and a half years later, here I am. I stayed. So something kept me there. And when I think about who I need to give my appreciations to, many of those people can't be with us today because they're my teams. They're people that have left STAR or busy working at STAR and can't be here with me today. So I do want to just take a second to say a shout out to Maggie Carr, to Lorraine St. Pierre, and to Michelle Raposa. You're probably names you don't know, but they're people who made my life work. I want to thank Nancy Paul, who was the former CEO who recruited me, hired me, and gave me the opportunity to run a research department. It's very unusual that someone does the kind of research that I've been able to do in a community treatment program, but we have been able to participate in 5 multi-site trials that put us in the table with people from around the world. I've done about 14 pharmaceutical trials, and we are part of cutting-edge research, which has really brought us forward into implementing evidence-based treatments and taking good care of our patients. The other thing that I was able to do was to help promote harm reduction strategies, low barrier strategies, and to make sure that the people that we serve get treatment at STAR. And so, as Sherry said, I help oversee, along with Lorraine St. Pierre, 900 people, 900 plus people who get buprenorphine every day. We save lives every day. As a psychiatrist, I worked 20 years without having anyone die on me, as we say in medicine. People die on you, not literally, but I didn't lose a patient. I became a psychiatrist in addiction medicine, and I started losing patients. Our patients with this opioid epidemic have pushed us all into a much more robust harm reduction strategy. I've been successful at being able to be part of that, but it wasn't my ideas alone. It's because I've had a wonderful team. STAR has changed a lot over the last 2 years. We have Sherry on board now. We have this lovely team over here at table 6 who are new leadership faces, and we're moving ourselves more into compliance and more into a center that's going to be embracing newer and different strategies. So I feel grateful to be a part of it. I thank you for the award. I thank you for thinking of me, Sherry, but I also am not going to sit down until I say that I have to thank my husband of 41 years, who's sitting here, and that he has been my anchor, he's been my best friend, he's been my strongest advocate. I couldn't have done the job without him. There's certainly good days and bad days, and he's been part of all of that. And I appreciate and love you dearly. So thank you.
Thanks, Dr. Bailey. Dr. Bailey, you're exactly where you need to be, right? That's really fabulous. Thank you so much for that inspiration. Our next award